So coming to my next section in my lecture today, which is an introduction to pathophysiology. As I started, this course is kind of a combo course where I combine pieces of health assessment, history, physical labs, and some knowledge of pathophysiology and some knowledge of pharmacology in order to be able to manage our patients better. So, pathophysiology. What's pathophysiology? It's the disease, the science of disease. It's the science of disease. What's the difference between disease and illness? You can have the disease, but as long as you are not manifesting it, you are not ill. When you start manifest the signs and symptoms of the disease, now you're ill. Remember this famous basketball player who had AIDS and kept playing basketball for 3 years, and during these 3 years he was diseased, but he was not ill. Syndromes are whenever we do not know the exact reason for this disease, we call it a syndrome. So, anatomy, normal structure. Physiology, normal function. Abnormal structure, abnormal anatomy is pathology. Abnormal function, abnormal physiology is pathophysiology. And any disease, any pathophysiology, any disease process starts at the cell level. Something is going to damage the cell, some cell injury, and the cell will try to adapt, and during cellular adaptation the whole tissue will struggle, but the organism will compensate and will keep surviving. But if that cell injury crossed a line and the cell starts to fail, then the tissue will fail, then the organ will fail, and the system will fail, and the organism will die. This summarizes any disease process. It starts with a cellular injury. And while discussing the pathophysiology of any disease, I have to distinguish between two things, the etiology and the pathogenesis. The etiology is what starts the disease, the cause of the disease. Pathogenesis is how it evolves, the steps it's going to take me from the etiology to the final clinical picture and even the outcomes.